health officials are urging Americans to get vaccinated. More than 51% of the population is fully inoculated, but there are nearly 80 million people who are eligible for a shot and have not gotten one. The Delta variant has been fueling a summer surge. More than 90% of U.S. counties are experiencing high transmission. But one health official says we could get the pandemic under control in less than a year if more people roll up their sleeves. Manuel Bojorquez is in Miami with the latest.
A day after the FDA gave full approval to the Pfizer vaccine, health officials are urging businesses to step up.
You have the power to protect your communities and help end the pandemic through vaccination requirements.
Dr. Anthony Fauci said the country could get the virus under control by next spring if vaccination rates rise.
Get vaccinated, and the time frame will be truncated dramatically.
18-year-old Danae Gutierrez of California says the FDA's approval swayed her to get the shot.
Social media that gets you kind of brainwashed into thinking that sometimes the vaccine can be bad.
Nationwide, the daily number of people getting their first shot has declined for 10 straight days, even as the highly infectious Delta variant pushes hospitals in some states to the brink. Today, Georgia's governor announced plans to send more than 100 National Guard members to hospitals across the state. Florida leads the nation in new COVID hospitalizations and is averaging more daily deaths than at any other time during the pandemic.
We have Pfizer, Moderna, and
Dr. Hussein Anan works in Miami Gardens, an underserved community in Miami-Dade County.
I tell patients always, be careful what you read. Choose where you're reading from. Are you reading from CDC, FDA, or are you reading from Facebook?
He's been leading efforts at this community clinic and online to combat misinformation and believes full authorization of the Pfizer vaccine will help. Having the full approval for Pfizer, how does that change what you do?
That added an extra layer of trust from our patients to say, okay, now, it is safer to take the vaccine.
His clinic is planning to host a drive-through vaccination event this Friday, but overall, government-run vaccination sites like this one are seeing a slowdown. The number of new vaccinations in Florida has been declining for 11 straight days. Elaine?
Manuel Bojorquez, thank you. Dr. Adam Brown joins me now. He's an emergency physician and the COVID-19 National Task Force Chair at Envision Healthcare. Doctor, welcome. So more than 9 in 10 U.S. counties have high coronavirus transmission. What are your most immediate concerns? Could this summer surge become another fall surge?
Well, first, thanks, Elaine, for having me today. And I think your question is an excellent one because we're seeing a really high number of cases across the country now. And as we move from outdoors back into indoors, we know that the chances of spread of the virus increase. And so this is even more of a reason why we need to encourage those Americans who are unvaccinated, children between the ages of 12 and 18 who can be vaccinated, to get vaccinated. Because if we don't, we'll continue to see that spread of this monster of a variant throughout the rest of the year. And as Dr. Fauci said, notice he made a conditional statement. If we get vaccinated, if we take control of this virus, we should start to see the end of it by the spring. I worry about if we don't, what will happen.
I mean, do you think that was going to be my next question? Is that a reasonable timeline when Dr. Fauci talks about spring? Because, we've heard timelines before, and some people may be skeptical of a timeline, even if it is conditions-based.
Yes, that's also a good thing to point out there, because timelines, while they're aspirational in nature, and I have to say, saying that the spring is an aspirational goal kind of hurts my heart just a bit. But the fact is that this is a very unpredictable virus. And what we have seen is as these variants have come over into the United States, or actually have grown here in the United States, and because we have not been vaccinated and not been speaking with one voice on how to attack the virus, i.e. ensuring that everyone is out there getting vaccinated, we're going to continue to see the spread. And so while I am hopeful to see the virus start to wane as more and more individuals get vaccinated, I'm also extremely concerned with new variants that could come about. In addition with that vaccine hesitancy that we're hearing so much about.
So a new CDC report found vaccine effectiveness may be declining because of the Delta variant. So what would your advice be, doctor, to people who are already vaccinated?
Well, I think number one thing is that, yes, we are starting to see that there is some waning efficacy of the vaccine when it comes head to head with the Delta variant. However, breakthrough infections are relatively uncommon, but what is more important is the uncommon nature of severe illness, hospitalizations, and death for those who have been vaccinated. So yes, we're starting to see a decline in the efficacy of the vaccine, but people should feel comforted in knowing that if they are vaccinated, that their chances of severe illness declines. As a matter of fact, today the CDC also reported that if you're unvaccinated, you have a 29.2 times higher chance of hospitalization versus if you are vaccinated. So that's even more reason that we need to ensure that everyone is getting vaccinated. But it does bring up the question of the importance of boosters. And so as we're starting to see, especially persons like myself, who are vaccinated in the early part of the year and starting to see some breakthrough infections, it kind of makes us starting to think about the importance of ensuring that we offer and have boosters and clear guidance on who and when people should get those booster shots.
So you mentioned this separate report analyzing data out of Los Angeles County did find the unvaccinated are nearly 5 times more likely to be infected and about 29 times more likely to be hospitalized with COVID compared to those who are vaccinated. And still the pace of new vaccinations in the U.S. has been slowing for 10 straight days. You know, there is such wariness still, as you well know, Doctor. What would you say to people who look at data, but are still skeptical of the vaccine?
The first thing I do is I listen to some of the reasons why someone may not want the vaccine. And there are so many different reasons that are floating out there on social media that are just not founded. But the second thing I tell people after I listen to them is that more than 96% of physicians, according to the American Medical Association, have been vaccinated. These are the same individuals that we trust with the health of our children, to treat us when we have different diseases, to do surgery on us, and then sadly to take care of us if we've not been vaccinated when we've gone to the hospital. So that's how I start out the conversation. And then I present to them information from trusted sources like the CDC, like the American College of Emergency Medicine, like the American College of Obstetrics and Gynecology, and showing individuals that physicians from across the country, with the only desire being the health and safety of the patients that we take care of, are coming together with one voice of the importance of vaccination.
Well, the CDC advisory panel will be meeting next week to discuss and vote on the Pfizer vaccine. This follows the FDA's decision to grant the shot full approval. Dr. Brown, what is left for this panel to decide on?
Well, the CDC typically will take some of the information from the FDA, look over some of the studies that were done, and just be a last check to ensure that it can be fully approved by the U.S. government, by the CDC, by the FDA. This is a very similar process that was followed during the emergency use authorization. And I think that should also make people know that there are multiple different agencies and individuals that are looking at the efficacy and safety of the vaccines to really build trust, to know that when they're getting the vaccine, it's one that has been vetted for efficacy and safety. And so I think that while it seems to be an administrative hurdle, it's actually a good signal to the rest of the country and frankly to the world that we're doing our part to have an independent review of the vaccine.
Finally, Doctor, health officials say it is unlikely we'll have a coronavirus vaccine for kids aged 5 to 11 before the end of 2021. Now, Pfizer says it's aiming to submit data for this age group in September. What does the FDA need to be sure of before it authorizes a pediatric vaccine? And is there anything that could delay this timeline any further?
Well, to the last part of your question about the delay, some of it is associated with a number of people or number of children that are being recruited into the vaccine studies. And so, again, trust is extremely important here when advising physicians or approving a vaccine. And so not only do the companies, which I do not speak for, but in reviewing some of the literature and knowing how vaccines typically are approved, they want to ensure that there are a number of individuals who are being tested and for the vaccine. We saw that with the 3 phases of clinical trials associated with Pfizer, Moderna, and J&J. during the latter part of last year. So the same process needs to be followed. But part of the delay is recruitment. And so we want to ensure that a number of children are involved in the studies to ensure the efficacy and safety of the vaccine, and also to ensure that the dosing is appropriate. So we'll have to see, but I do think that this is also another signal that the FDA and the CDC want to be sure and safe in the release of the vaccine and the full approval of the vaccine for children.
So many parents are so anxious about that pediatric vaccine. Dr. Adam Brown for us, doctor. Thank you so much for sharing your expertise with us. We appreciate it.
Thank you so much for having me, Elaine.